choice.
Well, welcome. We have a special guest today.
Thank you so much for having me.
Thanks for having. Can you tell us who you are first? This is Eugene Lipov, of course.
Yeah, of course.
Brain Hope Reality is my attempt at podcasting. So we have a real podcaster with us today.
No, you're doing a great job.
Well,
I
thank
like
you.
this setup. It's cool.
Simple, right? But to the point.
Exactly. It does what it's supposed to.
Thank you.
Yeah, so my name is Stefi Cohen. I wear a lot of hats actually. So I'm 32 years old, but I feel like I've lived like 7 lives. I'm a physical therapist by trade. I'm an athlete, been an athlete my whole life. I'm considered pound for pound the strongest woman in the world. See, felt it? Felt the power?
My shoulder almost came off. It was close.
Good thing I'm a PT. It would have been able to
Exactly.
fix it.
We'll put it back in.
Yeah, so pretty involved in sports. I have a career in entrepreneurship as well. I started a business when I was in physical therapy school within the software as a service industry. So we pretty much got into the influencer app space before everybody else did. And we're able to kind of like almost monopolize that particular niche, which gave me the head start into more like entertainment, public speaking, lecturing, and that kind of stuff. I'm a firm believer that in order to be successful, or the most successful people, I guess not the most successful people, but people who do this tend to experience success, which is gathering a lot of skills and then combining them in creative ways.
Right.
So,
a novel application of skills.
Exactly.
Makes sense.
So that's kind of like what I've been up to.
So what's your latest project currently?
So right now I'm working on a course. So I've spent like the last 4 years basically writing everything that I know about strength training. So it's kind of a principles of strength course. Basically, when I was in school, I was studying exercise physiology. And then even after graduating from PT school, I realized that a lot of the formal curriculum, while it gives you a really great understanding of fundamental principles, it doesn't really give you much practical application. So it's more kind of like theoretical and baseline stuff, which is so important for you to develop your critical thinking skills. You know, you can't bypass the basics and the fundamentals if you want to be great at something. That's 100%. The problem is that there seemed to be no bridge between evidence and practice. Like that's kind of like how I felt. I felt prepared theoretically, but very unprepared for
they
for
call
real
it
life.
like in medical space. I mean, you're in medical space.
Mm-hmm.
In medicine, they call it translational medicine, meaning you can have great ideas, but what do you do about it?
Exactly. But you guys have residency where you kind of are appointed a mentor and you have a program to develop your skills and you're being tested and evaluated. But personal trainers don't have that. And while I understand that we're not, responsible to the same degree as a medical doctor for someone's health, you're still, you're still dealing with individuals. You're still dealing with real people.
I would disagree with that because I know a number, like I've been a pain physician 40 years. I've seen a number of people get seriously injured by physical therapy. I would fix them by doing various procedures and then come in, it's like totally injured. It's like,
no, for
respect the range of motion. Don't break anything I fixed. Like, don't overstretch sciatic nerve. I mean, it's not too much to ask, I don't think.
Yeah, no, I agree. And things can get more complicated. I mean, you're a pain specialist, chronic pain, and the effects it has on neuroplasticity, on the brain. And if you're a physical therapist that is more mechanistic in your approach and you completely deny the existence of pain modulation in the brain, and you just try to attack the source of pain in a structure, you're also going to be doing a disservice to your patients.
Well, I think that's one of the things it's in many ways your perspective is very similar to my perspective. So what I mean by that is, like, I had formal training. I finished medical school in '84. Like, nutrition wasn't doing, like, I had 30 minutes on that. I mean, after 4 years, you'd think they could a little more kind of useful, but combining old principle with new applications, I think that's what makes it interesting. And I think in that sense, we're very similar. Like, stellate ganglion block's been around since 1926.
Since 1926.
It's the first time it was done. It was done for asthma.
Wow.
It's like, what? It was in France. So if you think about it, so then we go forth and the way I learned how to do it was blind, so no ultrasound, no X-ray, and just hope you get the right spot.
Oh my God.
It was for CRPS, complex regional pain syndrome, the burning of the hand, whatever. And then my brother actually conceived like burning of the hand and sweating is kind of the same as hot flashes. I was like, I don't think that's right. He said, just try it. So I tried it and it worked. But I knew it wouldn't work because I had no idea.
Yeah.
Formally trained, you're like formally trained. You can't, not only you're not thinking the box, you didn't even know you're in the box.
100%.
Right? And then people gave me all type of grief that I was an idiot, even though it worked, and called me needle plunger and got pretty ugly. I'll show you a paper article in Chicago Tribune. Anyway, so I ran across a article from Finland where they did T2 clipping, which is you have to move the lung out of the way, pretty aggressive for hand sweats. And they found out PTSD went away. I was like, what? What is that? So there was a great paper. Some red neuroscientists did retrovirus virus injection in the neck, and they found there is a direct connection from the neck to the brain, which nobody thought there was a connection. Like people like me, we were trained, stellate doesn't go to the brain. Well, it's been shown for years. There is a direct connection from the brain. And now people, like, it's only been about 25 years. Oh, CRPS actually is a central phenomena in the brain, not peripheral. It was like, what?
Wow, yeah, that's
right?
Interesting.
So, but it's like medicine, at least Western medicine, the strength of it is segmentation, heart, lung, kidney, right? Western medicine, Eastern medicine, integration. So you're talking about the same thing in physical therapy, like muscles. But like there was a Dr. Apkarian wrote a very interesting article, showed if you have back pain over 10 years, you lose 10% of the cortex. Did you see the article?
No.
Isn't that crazy?
So interesting. You have to send it to me. I wrote a book about back pain. Yeah.
Perfect. I'll send it to you.
Yeah.
But the whole point is there is such a feedback loop to the brain, and people come back, for example, from military action. No TBI, nothing, right? Just PTSD, pure PTSD. Their brain looks like Swiss cheese. They have significant loss of brain, like up to 20% of weight. Like, what? Turns out glutamate is increased by PTSD, and glutamate is neurotoxic. Right? Isn't that nuts? That's crazy.
That is crazy.
So there's the whole integration of all this is where it's really interesting.
So how is the research bridged to physicians, and how long does that process take?
How do physicians bridge it? How do they accept it? You're saying,
how do they accept the new the
new paradigm?
Paradigms.
Well, that's a tremendous question.
Because so where my head is going is it takes guts to change the narrative, especially in the world how we're living it right now with digital media and the high level of scrutiny that you get if you don't repeat the same thing everybody else is saying.
Right.
So
no, I actually I have three answers for you on that.
Please, let's hear it.
It's a massive pain in the patootie. You need to be pretty resilient, and you need to have good support. Like my wife is an amazing
and thick
support.
Skin.
Oh yeah, absolutely. Well, what's interesting, but every problem is an opportunity, right? And it sounds like a cliche, but let me tell you how it worked out in my life.
That's my favorite quote. Each
really?
Fresh crisis is an opportunity in disguise.
Well, let me tell you the opportunity. So I started doing hot flashes, and it was working well. So the Chicago Tribune came by, and they said, "How are you doing?" It's like, whatever. I hear it's working well. And I said, yes. I interviewed patients. Patients changed my life. I feel great. I can sleep through the night first time. As a breast cancer survivor, I couldn't have sex. I couldn't function. After the block, I feel great. So you think it'd be a good article. Oh, no. So this is 2005, right? Oh, no. So then they go, Bianca Kennedy, the beautiful breast cancer survivor, she's 32 years old, had severe hot flashes. She tried everything, nothing worked. After that, she was so desperate, she found Dr. Lipov, and she let him plunge a 3-inch needle into her neck. That was the beginning, right? So that's why a lot of my friends call me needle plunger now. And then they went to Northwestern, where I went to medical school, chief of OB, right? Whatever. He goes, oh, no, that's just absolutely wrong. He doesn't understand why it works. We shouldn't be doing it. No, this is really terrible, dangerous. They went to Rush, where I did my fellowship.
Mm.
And they go, what do you think? They go, oh, we didn't train him. Like, this is just terrible. This is terrible. He's a heretic, basically. I was quite annoyed. And that's what led me to read about 3,000 articles. That's where I found the Finnish article. So, or we wouldn't be sitting here today without it. So the interesting historical caveat, you know how doctors wash their hands? You ever hear that story where that came from? It's a beautiful story. Cautionary tale. It makes me very happy actually that I did better than he did. So Dr. Schmalzer or whatever, a very long name. He went to Vienna medical school, 1856, something like that. So he goes there and he finds that women who delivered in hospitals had 3 times chance of dying compared to at home. So the difference was, and he followed them around. So at home it was nurse practitioners, and then in a hospital with doctors, and doctors would go dissect dead bodies, run across and deliver a child. So at that time, the thought was if there was bad smell, it transmitted disease. They didn't know anything about germ theory. So he published on that, and he gave lectures and said, wash your hands. You'd think they'd be embraced, but no. So they kicked him out of medicine. He had a nervous breakdown. They put him in a psych institution, and he was beaten to death 1 month after admission. But the story's not over. 20 years later, when Lister figured out germ theory, he was hailed as savior of babies. But he was dead 20 years. But they didn't send the mechanistics, right?
Of course.
So that was a very educational for me. So I spent years trying to understand why it worked for hot flashes and PTSD. So I talked to my wife about it, and I said it works for hot flash, it works PTSD. She goes, that and for pain. She said, that is complete bullshit. One thing cannot work for everything. And she has a biochemistry degree, smart lady. So I said, all right, fine. So I wrote a paper, primarily for her, but I published it. And then I called it Unified Theory of Stellate Ganglion Block.
I love how she was challenging you.
Oh yeah, absolutely.
That's
she's great. She's like a true alpha. She's a very strong woman. I'm a good beta, but I'm not in her class really. She's outside my class for sure. But the point is that gave me an impetus, and that, again, here's it today. And the other part that was a quote that actually keeps me going is Linus Planck. He got Nobel Prize for Planck constant, physicist, 1925, something like that. He said, science move ahead at funerals. So you have to wait for the old guard to die. So I have very resistant skin. So, and I've had a lot of trauma, and I think people who've had trauma are the super achievers in our space. If you had no trauma, nobody ever tested you, you're like, okay, everything's fine. Why am I overacting? Like, and if you look to your right, there's a lot of special forces challenge coins. Every one of them had some kind of trauma, pretty much, as a young child.
Yeah, because it makes you want to seek whatever it is to overcome your previous condition, Yeah.
But I'll tell you one of my other kind of funny story at that time. It's like, you're old, there's a story for everything. Yeah. So I just finished my training. So as you said, I did 5 years in training. So whatever, this and this. My mother died by suicide when I was an intern. I've had trauma. So I was giving a lecture at Rush, and there was 1,000 doctors like me who finished all the training. So like whatever. So there's 6 people that's sitting at the table. And I gave my speech about something unusual about this muscle relaxant. Whatever. So the guy sitting next to me, the chairman, goes, I don't think you're right. So he asked the audience to vote if I'm right or wrong. So everybody said I was wrong. Like 1,000 hands go up that I'm wrong. I got up and I said, with all due respect, medicine is not democracy. Facts are facts. If you have any problems, come and I'll give you a paper.
Yeah.
Not a one came to talk to me. Not a one. So my chairman of my department goes, that was arrogant. I said, if I tell you it is, it is. He said, yes, I know. You always have a paper about something. So fine. But nobody gave me shit. So that prepared me. Like when I was in Congress, I gave testimony about stellate. This was 2010. So the chairman, Mr. Filner, like keep in mind, there's like 20 people for various institutions, right? This is Congress, U.S. Congress. He goes, how do I know you're not a crockpot? I was like, get you right there, does it? Get you right there. So that's why I think people like ourselves, I think it makes us resilient. And you're willing to try different things out of the box.
That's what I was going to say. It's really easy to kind of like sit on your throne of privilege of not having trauma and not having,
It's nice.
Mental illness or, not struggling with that, and be super skeptical and want to deny the evolution of treatments just because you don't have the necessity to have hope and faith for like a new treatment. All they have is skepticism, which is great.
I think it's, I don't think, well, I think that I have a particular perspective on that. Part of it is because my mother was on care of psychiatrist, right, for a couple of months. Then she saw him a day before she killed herself. She saw her patients like 3 hours before she died. So, but you can't tell. Mm-hmm. And there's also, I think, the mental health or lack of it is much higher than we think, because everybody's in denial land. Because if you have pain and it's always with you, you think it has to be like that. Mm-hmm. And the other thing is, if you think about it, unfortunately, my psychiatric colleagues, there are some amazing people, but there's a lot of people who are mediocre, shall we say. So they have set up success, what is considered success, 2-3% over years. Like if you look at Freud, the typical psychoanalysis technique is years. It's a lifestyle. PTSD, post-traumatic stress disorder, if you look at here, PTSI, post-traumatic stress injury, try and change the name. In fact, I'm going to try to recruit you to help you with that. PTSD is a term that was started in DSM-3 in 1980. It has not changed. PTSD has done some really, DSM committee, which has come up with terms, comes up with various terms, and a lot of them was changed. But again, so the point is, PTSD, to me, psychiatric condition does not to be a lifestyle. You can move on it. Because there's people still argue with, well, does it really exist? Are you sure it exists? Well, let's see. If it's a biological condition, let's look at the broken bone. And I have a great PSA I can send you. Broken bone, you should be able to identify it, diagnose, number one, and treat it successfully, right? That's basic. So if you have somebody who has a broken bone, you take an x-ray, you see the broken bone. You put a cast on and you're good. If it looks like a broken bone, you don't tell the people to run up and down the mountain, right? Typically. I mean, if you're an idiot, that you would, but sure you would. So when people say PTSD is invisible wound, right? So my answer typically is, it's invisible, they have the wrong scanner. If you have a PET scan or a MAG scan, you can see it.
Do they say the same about other medical illness or mental illness?
What do you mean? The scans?
Or do they say the same about the mechanism? Like, do they not understand it to the same degree that they didn't understand PTSD? Or can they see it more clearly? Because I thought that most mental illnesses are invisible.
Maybe. So first of all, I'm not a neuroscientist. Like, I'm not I'm self-taught, so I know PTSD very well. The thing about PTSD, you can invoke it. If somebody has PTSD and I show them horrible pictures, amygdala lights up. It's overactive. So it's, instead of this size, let's say it's not bigger. And if I show a picture of a military person, I show a picture of trauma, it gives them more so. Schizophrenia, I don't know how to clip it. I don't know how to activate it. I don't know. I do know the PTSD piece. And PET scan is another way to diagnose it. So there's a study done in Long Beach, for example. They had the most severe Long Beach VA. They found the sickest PTSD people they could find. They did PET scans. They did stellates, the stuff we're talking about. And the amygdala activation was reduced. So you can actually see a brain change, right? So there is a physiologic change. The other thing is, if you look at biological condition, broken leg, on a dog, like your friend of mine, let's say they break a leg, God forbid. Take an X-ray. You see the break. What do? You put a cast on, right? Human, same thing. Well, let's look at the same thing in dogs. In fact, I was the first one in the globe to treat PTSD in a dog using stellate. So I'll give you one example which kind of tells you where everything is, because sympathetic nervous system, that's one of the most basic systems. I'm sure with your education you know that. But there was a study done in South Korea that they induced experimental PTSD in rats. The way you do it, you drop them in the water and they start to sink. You got PTSD from you flush them out, whatever. They took half of them and did stellates on them, and the other ones didn't have it. So they put them back in the water. The ones who had stellate swam out. It shows you, because there's no placebo. People say, well, PTSD, is it real? Doesn't exist. It exists. You can see it in the scanner. But just the mere fact those rats swam out means they learned helplessness right away. Isn't that interesting?
That is interesting.
Because the limbic system in all mammals is the same. So you can develop, and the other part's interesting. If you cut out amygdala in a rat, or a human has amygdala stroke, you cannot give him PTSD. You can't get PTSD for it.
Wow.
It's gone. You need amygdala to have PTSD circuits.
Do you think PTSD?
That's bizarre.
It's crazy. But now I'm thinking about anxiety, panic disorders as a symptom of PTSD. Because you kind of get the same effect, when you get traumatized or something really bad happens to you, you get it.
What's the question?
The question is, do you think that anxiety, panic disorders could be kind of a symptom of PTSD?
If I may. So back to the diagnosis, right? So my psychiatric colleagues use this term.
Yeah.
It's not a biologic term. It's, PTSD is basically, in order to diagnose, you need multiple symptoms. So if you look at DSM, DSM people know me very well because I've been trying to change the name. So I'm a thorn in my side. Too bad. Well, I mean, it is because the only reason, by the way, I want to change that is because a 4-star journal, Shirelli, in 2013 said if you can change the name to this, people won't kill they won't kill themselves as much.
100%.
Why wouldn't you do that?
Yeah.
That's nuts.
That alone.
Right.
Should
Exactly. That should be easy. Anyway, so the point is, I think it's artificial difference. PTSD, anxiety, depression. If you have PTSD, you're going to have anxiety, you're going to have depression. So if you look at the backwards, like in pain arena, somebody comes in, CRPS, which is burning hand, and I do the block on them, 2 things can happen. 1, pain goes away, or it doesn't. Simple. If it goes away, it's called SMP, sympathetically mediated pain. If it doesn't go away, it's called SIP, sympathetically independent pain. Right? To me, all psychiatric disease is sympathetically mediated psychiatric disease or sympathetically independent disease. Why do I say that? Let's review the articles. 1942, Cleveland Clinic wrote an article about stellate for depression. Took away depression. Weird, right? 2023, Dr. Mulvaney and Lynch wrote an article that it works on anxiety. Now, you could, like, if you look at our patients, we evaluate for PTSD, anxiety, depression, because those are comorbid. You can't really separate them typically, right? But here's a weird one. So there was an article written in 2003 in Canadian Journal of Anesthesia. So the patient was from Japan. He was a schizophrenic. He gets kicked off the horse, fractures his shoulder, left shoulder. He gets a stellate done. After the first one, his voices, which were nasty, became calm and collected. After the second one, it went away. Why would that happen? Amygdala controls schizophrenia in many ways. So to me, and since I've tried schizoaffective disorders, type of schizophrenia, the point is, it's sympathetically mediated psychiatric condition. It doesn't matter. And you can't split them. They're all the same. So when you have depression with psychosis, right, when you see hallucinations, I would bet a lot of those guys will respond to stellate.
Oh, that is interesting.
Yeah, so the whole DSM to me is a very highly outdated, first of all, plus we need physiological measures. FMR is $5,000 per scan, very expensive. They have others like EEG, I think is not very effective, in my opinion.
Mm-hmm.
But that there are other things coming like DNA testing, epigenetic change, all of that.
Mm-hmm.
But I think people don't understand is PTSD causes physiological problems, such as somebody has PTSD, the chance of developing heart attacks is twice as high. That's not good. 85% of men have sexual dysfunction, which is fixable by doing stellate. I wrote a chapter on that. So part of, since my mother had PTSD from my father, who got it from World War II,
Mm-hmm.
so we call it secondary PTSD.
Mm-hmm.
Like I have it too, but I had treatment and I'm fine.
Mm-hmm.
So what we're trying to do, especially with special forces, we treat the guys, the women, and the kids.
Wow.
Right? Because you can look at PTSD as STD.
Wow.
Because if you heal the guy, but the woman is still there, she triggers him and they keep going back and forth. So if you stop it, it's like, oh my God, we can have sex, we can sit around, not fight, we're not arguing about anything, we're enjoying our lives. What? What is that? That's what it should be. That's what, to me, that's what treatment, that's successful treatment. Not talking about, we had a breakthrough today. Ooh, maybe another one tomorrow. No, it set you back. What? Because you're asking someone with a broken leg to keep running.
Mm-hmm.
Fix the leg
Mm-hmm.
and then make him run. So what we find, a lot of people can do a really good job being participating in psychological care.
Mm-hmm.
So then it's really effective.
Mm-hmm.
Because then 2-3 months and you're done.
Mm-hmm.
You can reduce the meds. You know how many drugs, average amount of medications, men or whatever, women, in the VA take for PTSD? 15.
15 different kinds?
15 drugs, yeah, different kinds. So I mean,
for one person?
One person.
That's not good.
No, because, well, what happens? You give this drug. Oh, no, it has side effects. You have to give this drug. Oh, no, this drug. No, you can't sleep. Okay, we need to be awake. So, but for example, one of my favorite drugs, or least favorite drugs, is atypical antipsychotics, like resveratrol and Seroquel. Those drugs, 1 per year use. So if it's 2 years, it's 2 out of 1,000. The heart stops and they die. Because diabetes, impotence, nothing important, right? It's like diabetes, impotence, heart attacks, whatever, cardiac still, and we're still using it. It's one of the most common.
People don't bat an eye for the side effects that has.
Not a problem.
No.
We have no problem with that.
Yeah, it's just
well,
a tiny warning.
A lot of women toss that. I mean, they make their guys throw that particular drug in garbage. It's expensive. So the fishes are now antipsychotics.
Oh my God.
Is that scary?
It really is, because they're contaminating the water.
Exactly.
My God.
It's
well,
no
at least
joke.
the fish are chill, no? Have diabetes.
Well, diabetes, heart attacks. More fids. I don't know. I don't know what does to the fish, but I wouldn't want to find out. I don't want to eat that fish.
No. But you know what? That's been one of the most frustrating parts about growing up with panic attacks and generalized anxiety disorder is I've always felt like it had a physiologic cause. Like from a time, I remember the first time I experienced a panic attack, probably was like 11 or 12 years old at one of the summer camps, and I experienced the physical symptoms of the anxiety.
Right.
And in my mind, they didn't come about because of any particular reason. They just
happened.
Just happened. My heart rate increased. My hands started sweating.
Did I feel like your chest was squeezing?
Yeah.
Heart, take a deep breath.
Heart, take a deep breath. Dizziness, dissociation. I had a lot of physical symptoms, and the solution from my counselor at that time, it wasn't even a psychologist, was to talk it out, to talk through it.
Great plan.
What are you afraid of? And I remember at 12, I was afraid of being afraid. I was afraid of the sensation that I was experiencing.
It feels uncomfortable.
Yeah,
it feels scary,
really
right?
Uncomfortable. You don't understand it. You don't know how to get out of it. Sometimes you can't, and the only thing you can do is go to sleep. I don't know. Sometimes it's out of your control. Sometimes it goes away when it wants to.
Let me give you a weird concept. Do you know what it feels like to feel doom, like that thing is going to happen? Mm-hmm. Do you feel it now?
No.
So let me tell you a funny story. So there is a disease called pheochromocytoma. You probably never heard of it. It's exotic. It's one of those zebras. 1 out of 10,000 people have it. The way it presents a lot of times is strokes, heart attacks, very high blood pressure. It's adrenal gland producing norepinephrine, too much norepinephrine, right? So you can see why it would be a problem. Mm-hmm. Number 3 symptom is doom, feeling of doom. Mm-hmm. If you take it out, feeling of doom is gone. Mm-hmm. Why? Too much norepinephrine. What do you think stellate produces? Norepinephrine. It's biologic.
Exactly.
That's my whole. It's a biologic. If you look at it biologically, and then you can do psychological intervention, that's the effective method.
So then, I mean, they do prescribe propranolol to lower your heart rate, keep it under
You know the problem
control.
with propranolol?
What?
It's a beta blocker.
Yeah.
Norepinephrine's alpha blocker. You need alpha blocker.
Yeah,
You
it
need
doesn't solve the
prednisone.
problem. That just
Right.
decreases one of the symptoms. That's
But my point is, beta blocker won't even touch it.
no, exactly.
So the only thing that's effective for sleep for PTSD is prednisone, which is alpha 1 blocking agent. It's not as good as stellate, but it works on the same principle.
Mm-hmm.
It's all norepinephrine.
Mm-hmm.
So propranolol, it won't do anything. That weird?
It is, but
anyway,
I understand the skepticism from the medical industry as far as accepting a new treatment, but I think like it's really rare to find practitioners like you that are genuinely interested and passionate about what they do. I'll give you an example. I've been looking for something like this for quite some time, maybe 2 or 3 years. You know, I've been looking into ketamine treatments, alternative treatments.
Right.
I don't want to be taking meds. I don't want to take more meds. You know, I want to figure out a way that I can truly have my condition under control and it's not constantly surprising me at random times in my
Right.
life. But I never, the appointments, meetings that I had with these people felt like such a sales pitch.
Yes,
that
it is.
It is.
Well, the model, well, part of
But
a good
because
thing.
they're not passionate about it, they don't
Right.
understand
Yeah.
it, they haven't done the research, they don't,
Yeah.
and that doesn't, as a patient, it doesn't make you feel like you can trust
Confident.
the person. Exactly.
Well, you know, the reason I'm passionate is because my mother.
Yeah.
Right. I mean, it's pretty clear. So that's part of the reason. I mean, for me, it's an amazing plus to see people do well and thrive, especially women, obviously men and women, and children. Like I did it with my kid. So no, I appreciate it.
No, I know.
Anyway, I think we should summarize, and maybe we'll do something more later.
For sure. But let me finish my
Go ahead.
compliment
I'm
because
sorry. You're so
like,
nice.
seriously, because
Thank you.
no, you
You're
guys
kind.
are so awesome. Like when I first made my appointment and got connected with a nurse practitioner, Haley, what's her name? I forgot.
Heather.
Heather.
No,
Heather.
not Haley.
Hannah.
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 Yes, I knew it started with an H. And I had the consultation with her. Just that alone, for example, I didn't know about your passion for this, you know, when I came in. But the entire process kind of exudes that confidence and real focus on patient care. So
thank you. Well,
it's really rare, it really is. So I appreciate it.
But you know what my father used to say? Fish stings from the head.
Fish what?
Fish stings from the head. Anybody who is not that caring, I'm not gonna work here. I whacked them all. We had a couple of people like that.
Yeah.
Because it could be my family, right?
Yeah, for sure.
It could be my friends. It could be. I mean, why wouldn't you treat patients like your family? If you don't, then either you hate your family or there's some other problems.
Yeah. Or you need a block.
Something. Well, hopefully you feel good. Do you feel any different than compared to when you came?
Yeah, I do. The perfect way that I can describe it is serenity. That's kind of the word that I felt like.
It's probably as good as possible.
Yeah. So coming into the treatment yesterday for the right side, I felt upregulated.
Mm-hmm. Of course.
You know, I just felt like
revved up.
Revved up, which is how I usually feel.
Right.
And literally, I got the block, and immediately after, I felt kind of like as if the noise of the world shut up.
You know, it's interesting. One of the people who treated is a sci-fi writer from Portland. And he said, the block stopped the chattering monkeys in my brain.
It's exactly
like cute description.
That's exactly it. It's hard to describe the sensation, right?
Mm-hmm. Yeah.
But that's something like that.
Well, I hope it goes great, and I hope maybe we can work on changing the name. I think we can save a lot of lives with that.
I agree.
Thank you. Thanks for coming.
Sure.
Really appreciate it. Okie dokie. Before my patient.